So for those of you that have joined us, thank you so much. This is Hope Lives Hope Talk on navigating insurance appeals and approval. My name is Sunny Mullen, and I am the Director of Outreach with Hope Live. And I am joined today by two of our wonderful members of our community. Ali Ingersoll is a day trader, disability strategy consultant, Miss Wheelchair America 2023, a writer and a public speaker, and so many more. Ali's professional passion lies in coaching organizations on how to strategically create and implement disability inclusive policies and practices within organizations to employee resources groups. She accomplishes all of this through teaching how to minimize bias, increase advocacy, accountability, access, and inclusion internally. Ali started her healthcare advocacy career after being repeatedly denied medical necessary equipment by insurance companies over the last 12 years since becoming a C6 quadriplegic and full-time wheelchair user after a shallow water diving accident. She focuses much of her advocacy work on health equity through helping people with significant disabilities get the proper approvals for the medically necessary equipment they need to not only survive in life, but to thrive in order to achieve a higher quality of life. And with Ali, we have Karen Roy. Karen Roy has a T10 complete spinal cord injury sustained when she was shot in an armed robbery while she was a student at Louisiana State University in 1987. She has been passionate about advocating for all people with disabilities to have access to the technology they need to stay healthy, especially standing devices. Karen is a licensed clinical social worker with more than 20 years of experience, primarily at the Neuromedical Rehab Hospital, where she specialized in the case management of patients with spinal cord injury and other neurological disorders. Helping others after debilitating injury or illness was her reason for becoming a social worker and joining New Motion in 2015. The purpose of her role as a brand ambassador with New Motion is to serve and advocate for their customers. So we are so happy to be joined by both Karen and Ali today. And just a quick housekeeping, we do have our Q&A section where if you have any questions for our two panelists, please put them in there and we will get to them. We also have our chat open. And just a reminder about Help Hope Live. We are here hosting this Hope Talk, but we are also a national nonprofit that is here to help you fundraise for all of your medical expenses and related costs. All of these items that hopefully you don't have to go through some of these fights for. But when you do, let's have this conversation so we can help you try to figure that out a little bit better. So ladies, thank you so much. And I know I went into a little bit of your backgrounds, but Karen, Ali, if there anything you want to add in your introductions there, or what brings you joining us on our Hope Talk today?
Well, I would love to point out that Karen is Miss Wheelchair America 2019.
Yes, I'm sorry.
And I got my
to
cue to run from her.
Yes, absolutely.
Yeah, the minute I met Ali, I was like, yeah, you're gonna do this and you're gonna win. And I was right. But yeah, advocacy, like the minute I met Ali, like that's been my passion from day one. I knew that anything I needed, it was pretty evident to me, including like length of stay in rehab. You're gonna have to fight for it from day one. And if you're not a fighter, it's gonna be a tough road.
No, unfortunate.
Yeah.
You're right on the day one. Day one, they wanted to kick me out as a quadriplegic after 2 weeks.
Yeah. Yep. So anything you want to get, I mean, whether it's therapy or it's a piece of equipment, that should be obvious, it should be obvious, right? But it isn't. And I think we'll kind of get into that, but yeah.
Absolutely.
And I'd like to add to whatever advice Karen and I give, no matter what advice or tips and tricks, as Karen mentioned, if you're not your own advocate and you don't fight for it, it's not going to happen. That's just a reality. We're working towards systemic change, but we're trying to work within a broken system as it is right now.
Absolutely, it is. And it's awful that, I mean, we've already mentioned it a couple of times, just the fight, and that this community is constantly in a fight, which is just tiring and exhausting. So with all of that, You each do have experience of the process with insurance from a personal standpoint, but also Karen from the New Motion, being a brand ambassador with New Motion from a vendor standpoint. What is generally the first step in getting something approved? You know you need a new wheelchair, or you know you need a new piece of equipment. What next? Ali, what is the next step, and what do you do there?
Well, that kind of depends equipment. So wheelchair, CRT, complex rehab technology, that's a little different process as compared to, say, getting a specialized mattress or a shower chair approved. But for the purposes of now, because Karen and I can go back and forth, and Karen works with New Motion, let's start with wheelchairs, right? Many of us with
And I also,
significant
as we,
mobility-
I don't want to interrupt, but as we did just mention before this call, I want to put out a caveat that obviously Karen and Ali can speak from their experience, and their experience as being an ambassador, but insurances are all different. So if you have any specific questions, certainly let us know. We can address them, but there may be things that may only apply to their experience versus what your experience is. So hopefully we can help from a broad perspective. Sorry, Ali.
Yeah, no. And so my experience basically started out when I spent a year in bed with a stage 4 pressure sore down in my bone. I had a year to contemplate getting very angry when everything was being denied left and right, from health insurance, from pressure wound vacuums to surgeries to total hospital electrical beds to mattresses, and then after to wheelchairs. But with wheelchairs, the first step is you're going to need there are multiple parties involved. You have your durable medical supplier, and whatever company they work with to get their wheelchair from a manufacturer. And then you have your seating evaluation with your physical therapist. You have you as the patient, and then you are going to have your special physiatrist and or general practitioner who are responsible for writing your letters of medical necessity. So those are generally the 4 parties involved for the start of getting a wheelchair approved. Now, just as a caveat, if you want, say, a mattress or something approved, or a bed frame, that generally is only going to involve your general practitioner and or your medical professional, whether that's a physiatrist or cardiologist. So it's a little bit different, but with durable medical equipment, that's complex rehab technology, that's a little bit more involved.
Yeah. The first step is, I mean, you have to go to your physician, right? And they're going to have to write the orders to get you to the clinic or to the therapist who's going to do that initial evaluation for the complex rehab. So I think my first piece of advice would be to get to know your doctor and let them get to know you really well, because you're the only one that can explain to them the equipment that you need and why you need it, right? So they're going to have to be painting that picture for everyone involved, and that starts with a lot of documentation. So the explaining to your physician what you need and why you need it. Obviously, sometimes you don't know that off the bat, right? But let's just say this isn't your first chair, and this isn't, you're not inpatient rehab and you're outpatient. You're gonna have to explain to them so that they can paint a really clear picture to everyone else why this equipment is going to be needed. That relationship is going to be key in the long run.
I'll add to that on the physician side what Karen said. Another piece of advice with getting to know your physician is that they're only spending 15 to 30 minutes with you, right? So they have a standard list of questions. You know you best. You know why you need a seat elevator for your power wheelchair. You know why you need a special mattress. So tell them, because they're responsible for writing such a key document called your letter of medical necessity. Essentially what this is they will put your diagnosis code, whatever your medical condition is, all of the codes in, and they'll write a letter saying why said piece of equipment or service or prescription drug is medically necessary. That's a key word, right? But oftentimes, I have my father grew up me on an expression, trust but verify. So don't just blindly trust your doctor.
Confirm.
Right.
I am a true believer in that.
And oftentimes, and I'm sure Karen has seen this, where they've written 3 or 4 sentences for a letter of medical necessity. If you literally go to your doctor and you say you need a pressure relieving mattress, okay, why? Let's just take a couple. If you have mobility impairments, it relieves pressure sores. It helps with respiratory issues at night by putting the head of the bed up. It prevents pressure breakdown for pressure sores. Just write those on a bullet point list on your phone, literally even just hand them to your doctor and say, these are the points I need you to cover in this letter, because I promise you, unless they're specifically trained in your disability, they're not going to know that. So that's tip number 1. one on the letter of medical necessity physician side.
And Karen, from the vendor standpoint, like when do they even come in? What are you, I mean, I know in your work with New Motion, what are you seeing from that angle?
It depends on if it's a brand new, if you're in inpatient rehab, right, and you're in a clinic, so those therapists are working with certain suppliers, and so a lot of times they'll rotate the supplier within that clinic or within that hospital, whether it's inpatient or outpatient. So sometimes it's in the beginning, it might be randomly selected. It also might have to do with what your payer is. Are you Medicare? Are you Medicaid? Do you have private insurance? And who takes your insurance as far as that suppliers? Like, that might be the beginning part of it. You may have more choice later on, but sometimes in the beginning, it's really kind of random. Okay, of course the dog's gonna bark now.
You're like guests.
Yeah. If that's happening, right, then they'll contact the physician is there in the hospital, right, and they're going to be writing the orders, but they're also pulling chart notes. They're pulling the notes from the physician. They're pulling the notes from the therapist as well. So all of that is really, really important. So if you're starting the process from scratch, obviously you need to begin with your payer and find out who's in network. And that may be your starting place for which supplier you're going to be working with. And then the manufacturers are chosen, hopefully, because you're going to take components of different pieces and parts of chairs, but the therapists really know the person and what their anatomy and what they need. And then hopefully the ATP is the person who knows the technology really well and then can choose which manufacturer. So as a supplier,
Karen, can you tell people what ATP means?
Assistive technology professional. So they are the people that are the main employees of a supplier, and they have the relationships with the therapists, and they're the ones that know the technology from each individual manufacturer and hopefully marry, the person's situation with the perfect combination of technology. It may not be just one manufacturer.
And I'll give an example now with ATP. So when I was getting my seat evaluation, my doctor called in a prescription to go to my physical therapist to get a seating evaluation for my new power wheelchair. The ATP from my durable medical supplier, they came over to the seating evaluation clinic as well. And the physical therapist, they know your body and how you sit, and they know your musculoskeletal structure, right? And they make recommendations. The ATP in turn listens and tries, like Karen said, tries to match you with the proper piece of equipment, again, based on your payer. Everything, let's be honest about this. Everything's about your payer. You're only working with people that are in network unless you have a ton of money and you're going to pay out of pocket, right? So if you're
fundraising with Help Hope Live.
Or if you're fundraising with, thank you, not fundraising, Help Hope Live. So that's kind of right. That's from the patient side. That's how they kind of work together in the process.
Yeah. And with all of that too, and I know that from personal experience, and I'm sure probably everyone could put in the chat here who's on this call so far, the next thing you end up hearing almost all of the time is denied. Is, the request has been put in for the approval. How many times have we all just heard that request is denied for what?
Well, that's on purpose. All health insurance automatically deny prior authorization unless it's something easy like a cholesterol medicine,
I always say, and it comes back to that word fight. And unfortunately, I really think they just bank on individuals not fighting for it.
Well, do you know a fact? 1/10 in the United States in 2023, 1/10 of 1% of denials in the United States, 1/10 of 1% were appealed. So they're just banking on you. That is a very tiny, they're just banking on you saying, oh, okay, I didn't get approved. It must not be medically necessary, right? That's where they make their money.
Exactly. It's so wild because of that. And the fact that they are constantly keeping this community in a state of fight is where that exhaustion comes from.
It's an unpaid day job. Let's not sugarcoat it, right?
Completely. A lot of people I've talked to, our Help Hope Live clients and others, say that they're so much more busier post-injury or illness diagnosis than they ever were when they were working a full-time job, because they are
you're doing both. You're doing both.
Absolutely. And not to dishonor those who are doing both, but it is something that no one should have to handle by themselves either. And I know you both kind of spoke about being your own advocate. How have you both found that? And did you have support around you? Because there are those people, we see it all the time at Help Hope Live, that maybe don't have that person that can advocate for them. How
Karen,
did
I'll
you
let you
guys
take
learn
that
to
first.
become your own advocates?
I came from a family of fighters. So when there's a standing robotic device in my background back there. And so the very first thing I saw when I got to rehab was standing devices and a functional electrical stem bicycle that I knew I was going to need both of those to stay healthy throughout my lifetime. And my father, they denied, gosh, I know that the FES bike right away, and other standing devices. And I remember him threatening to fly out to the CEO's headquarters in California to have this conversation in person, about, because there was already data in 1987 to talk about the benefits of FES and standing for that matter. And so he was like, yeah, it's not experimental, but he just basically every appeal that came up, all of the paperwork, you have to be willing, if you are a caregiver, have to be willing to call doctor's offices to get extra documentation that you need and to continue to have the argument. I mean, it gets ugly at times. I remember my father, eventually he wore them down and they said they would pay for the FES bike. But they were going to own it and they were going to just let us use it. And my father said, that's fine, except the rent in my home to keep your device is like $2,000 a month. Eventually so I came by it. Honestly, I was fortunate that I learned, I got led by example.
I had a little different story where I wasn't my own advocate at all for 7 years. Like Karen, I had a really supportive family who fought for me, but we moved internationally, so life was cheap and I got what I needed. I really didn't become my own advocate till 2015 when I moved back from China to Raleigh. And I took over health insurance fully on my own without the family's help. I mean, I was working full time, and Obamacare was in the full swing of things with the health insurance marketplace. And they were actually gray pans and you could get anything you wanted. Now, actually, while you can't discriminate against pre-existing conditions under Obamacare, they've already done that by default by constantly limiting the networks that you're able to see your doctors every year. So they are discriminating against us. So in any event, when I was denied, I was stubborn and I didn't want to ask for the family's help and I wanted to do on my own. Now, what I did, and I don't want anyone to have to go through this because it's not fun, is I just started reading corporate policy and writing my own letters of medical necessity. And then I learned a little trick, and this was in about 2020 or 2021. I just started at first for fun, but then for real, just trying to get every piece of durable medical equipment or prescription I could get approved just to see how far I could push it. And we'll dive into the first level appeals and second level appeals. But essentially, like one little tip and trick I learned is you may not write the letter of medical necessity for yourself or your doctor, and you could give them the bullet points because you may not be a writer, but you always want to back it up by peer-reviewed journal articles. And again, you don't have to be a scientist. You can literally type in, for example, if you get really bad pressure sores and you need a pressure relieving mattress, you can type in pressure sores, spinal cord injury, or pressure sores, even more simply than that, sedentary lifestyle. And you just go to Google scholarly articles. It's not rocket science. You can just like click the top 3, find like 3 sentences, or just literally put the links in and send them to your doctors. And you just cite a couple, right? But that is like a really key piece of evidence showing that after you've been denied prior authorization, you throw that into the appeals letter, and we can go to that process in a minute. But those are some of the ways I started to fight. But when I, like Karen, when I get angry, I get active.
Yeah, and the companies themselves. So the company that was making the FES bike that I was using, or the standing device, a lot of times those companies will have the most recent data, the most recent articles available to them. They will give them to you, right, and provide them to you, so they can kind of guide you through that process as well. Because there's good data and bad data, and sometimes it's good to kind of dig in a little bit.
And so in both of your works with Miss Wheelchair USA and the advocacy that you
we have to correct you there. We have to.
It's not Miss Wheelchair USA. I'm sorry.
I know they're 2 separate organizations, but it's America.
Miss Wheelchair America. Oh, no, but
Yeah, only
in
the
your
reason the only reason we probably is, well, they are two different organizations, but and Miss Wheelchair America specifically is basically is advocacy based completely versus like Miss USA is a little bit more of a
Yeah.
traditional pageant. So anyway.
No, that's a very important distinction. So Miss Wheelchair America, with all of your work in that and the advocacy that you are so passionate about, I'm sure you've had conversations with others though that maybe didn't come from the fighter families that you've had, or didn't have the drive to go find those scholarly articles. What are your tips for people that maybe don't have that community or don't know what next to do?
I get those texts and emails and calls a lot actually, and I do dedicate now a certain percent of my week to helping people. And I say to them, I said, all right, get me your denial letter. Let me just see what the doctor wrote. If he put the wrong code in or a 3-center letter of medical necessity. Now, only about 20% actually come back to me. The other 80% fall off, which is fine. They think I'm going to do it for them. I'm not going to do it. I used to do it for people. I'm not doing that anymore. You have to be your own advocate, and I will literally guide you through the steps. And I have folks that can too. And I'm surprised how many people actually don't. They said, here's everything. Can you just figure this out for me? And I'm like, listen, I really want to help you, but I also have a full-time life at the same time. But you're right. If you don't have family, there are a lot of resources out there, like even your durable medical providers like New Motion, and Karen can speak to this because I'm not going to speak from New Motion, but they have a whole advocacy team that walk you through the process, right?
Well, yes. And I mean, so we have a whole teams of people that's what they do all day long is they know exactly what the paperwork needs to look like. They know exactly what the dates need to be. And they are calling the doctor's offices, right, and trying to get that there, and they're going to the insurance companies as well. We don't stay in business getting denials, right? I mean, if we're in the business of
you're trying to sell
wheelchairs,
your equipment,
and we're starting to do it in a timely manner, right? So nobody wants your chair to be late at New Motion, but and I will say though that I think that's when you have to kick in and because we can send 6 requests, and there are fax machines in those doctors' offices. And I worked in a hospital for 20 years before I worked for New Motion. Faxes get lost, requests get lost. They're drinking from a fire hose, as my father used to say, and they're trying to sort through it. So it's like the squeaky wheel gets the grease, right? And then so they may ignore the supplier. They may ignore our request. They have 14 requests from New Motion, but you're the customer. You're not the patient. You are the patient, but you're the customer. And so your voice has sometimes more power, and that's where you might need to get involved. But yeah, as far as what the documentation needs to look like and what the dates need to be signed, and there's some confusion, in the process of getting complex rehabilitation, there's something called a face-to-face. The face-to-face evaluation is signed by the physician after the 16-page wheelchair evaluation is done. And some physicians think that the person needs to be in the office on the date that they're signing the paper because the way it's named. And I think that might be on purpose by Medicare, just because it makes it sound like they actually have to be face-to-face. But sometimes we have to go in and explain to them, this means that you ordered the 16-page evaluation and it was completed and you were signing off on that evaluation. It doesn't mean you saw the patient in your office on that exact day. You did see, so it's complicated for a reason. As Ali said, insurance companies and payers aren't, necessarily, they don't want to make it super, super easy, right? There was fraud in the industry many years ago, and they've put all these safeguards in place, but so many now that it blocks people who need it from getting what they need.
But it's also really important too. And then the next step is to understand the denial process, just the basic and very broad strokes, right? So whether it's Medicare, Medicaid, or private insurance, it's a little bit different from each. But the similar process, you get a prior authorization denial. Oh, there you go.
Yep.
Oh, you got my back graphic up. I thought I lost you.
Go.
So you get a prior authorization denial, right? Then the next step is you go through a first level of appeals. If you are denied, under something that's not medically necessary, you can keep going up the ladder of the chain. If you get denied under something that's a non-covered benefit item, meaning it doesn't have a code, like a piece of adaptive exercise equipment, you're just dead in the water. So we're not going to touch on that today. If you get denied the first level of appeals, oftentimes if it's something complicated, in our case with our disabilities, you're going to get denied again. Then it goes to a second level appeal. Once, if you're denied a final time by your insurance company, then you're going to get something called, terrible piece of paper, final adverse determination of benefits. It's a fancy way of saying like rejected, like that big packet in college where it's like that rejection letter, you know. And then you have avenues from a legislative standpoint with Medicare and Medicaid, or with your Department of Insurance. But if you just kind of dissect that, and I'll kind of give this in broad strokes since we only have an hour, just to let you know, the reason with prior authorization denials, the people that are looking at these cases, most times, and I know this for a fact, and I can't tell you how because I learned up from higher ups and I was sworn to secrecy until I die. They're not looked at by medical professionals at all. They're looking for a specific code, and that's it. And if it's not under a specific list of acceptances, you're denied. The first level of appeals and the second level appeals, they're seen by two different people. You have basically a review panel within your insurance company. Sometimes you get a doctor's physical therapist, sometimes you get a general practitioner. And your first level is kind of like they don't know much about disability, so your chances of something complicated getting approved, they're still pretty low. Your second level appeals is where you get a higher panel of experts, people that are slightly better at their job in the insurance industry, but you're always going to have a medical biller or a coder. But this is where you're really going to, in each step of the process, your letter of medical necessity essentially stays the same from your doctor. You just add to it a little bit on the second level of appeals. But this is where on the second level of appeal, you can really, you can add your own personal patient letter into it as well. Whether it does anything, I don't know, but the more paperwork, the better as well for this one. And then if you are denied to the highest level, and again, I'm skipping a lot of steps and there's a lot of tips and tricks, which I'm more than happy to share. It's in this website as well. You can submit if you were denied under not medically necessary, and they say, no, there's no way you're going to get this. You can go to the Department of Insurance within your state and file an external review. It can take several months. So if you need something quickly, you can file an emergency where they'll look at it in 72 hours, but they have the right essentially to overturn your insurance company's final, essentially your insurance company will be forced to pay for it, whether they like it or not. And if you're in Medicare or Medicaid, it's more of a judicial process. We go through the courts, similar concept though. So that's kind of a broad overview of the whole cycle.
Yeah, the peer-to-peer reviews. So that, I think, again, that goes back to really your physician really knowing and you having painted that picture for your physician, because they're the ones, when you talk about peer-to-peer, it's usually physician to physician. Sometimes they actually have phone conversations, right, about it. And your doctor better know why you need it and how you're using it. How are you using it in a functional manner in your home to be more independent, right? Because those medically related activities of daily living are going to be what they're looking for. And, you know, sometimes your physiatrist is talking to like a podiatrist, you know, I mean, a retired,
it's true.
Right. So that podiatrist doesn't know a darn tootin' thing about wheelchairs, custom wheelchairs and pressure relief. You know, they just don't. That's not what they went to school for. So again, I think it goes back to.
And what Karen said too, though, so doctor not knowing a lot, educating your doctor and teaching them about what are these called trigger words. Okay. And so I learned these trigger words for someone very high up in Blue Cross and Blue Shield one time. She said, if these 5 words are in your paper, you're done, right? Like this, anything, for example, wheelchair, if you have the word out of the home, done. It's got to be in the home, right? So some good trigger words, for example, as Karen mentioned, is MRADLs, mobility related activities of daily living. They want to see words like quality of life. They want to see a reduction of cost. So this piece of equipment or service or medication is going to reduce the incident of long-term hospital stays, which is going to be more expensive, $100,000 as an example of a hospital stay versus a $3,000, piece of equipment that is, quote, they determine it's not medically necessary, that you're trying to prove that. So you have to be careful on the words you use. And, it's in the website with some of these trigger words, but you can even look some of them up as well. Some of them are on the internet, and there's some really great examples. And I have great examples here of letters of medical necessity as well. But how you word things, like if you had anything emotional or personal, you want to think they have a heart. I'm sorry, but they don't, right? This is not appealing to their humanity, sadly.
And I know you've referenced a few times the website, and it is right here, but it is a little small. Ali's article that she wrote with these 5 steps is on spinalpedia.com.
Spinalpedia is run by a beautiful friend of ours named Josh
Yes.
Basil. He's a quadriplegic lawyer, advocate, nonprofit. I mean, the list goes on. Anyway, I partnered with him, and he has an incredible organization called Spinalpedia. So it's a whole website section on his website. It's on mine as well, but we wanted to be able to.
Yeah.
I love to share. We all need to share resources together.
Yeah,
Absolutely.
that's the answer to your other question, Sunny, too, is like, you may not have a family of fighters, but you can go to places like spinalpedia.com and Ali's website, and New Motion we have a ton of blogs and articles and things that we've written up there. So I think you have to reach out to your friends in the community.
Yeah. And I will say,
it.
just even on that wider stroke of Help Hope Live does have resource directories on our website. My go-tos are always the Christopher and Dana Ree Foundation, United Spinal Association. Josh
And
Basil
Karen and
is-
I work with all of them as well, right? Yeah. We're all little nuggets of little experts in our little area, right? None of us pretend to be an expert in everything. Yeah. So a lot of this, what does it come down to, right? It comes down to being your own investigative reporter in your own life. Yeah. So you don't know the answer. You don't have a network. You don't have a family. Okay. Maybe you watch this, or you're watching this webinar in a year from now, and you're like, okay, I'm going to reach out to Karen. Karen may not know the answer. She may throw it over to me.
It. Yeah.
You'll find it, or she'll throw it to me, and I may throw it to somebody else, but somebody will help you, because we are, like, in this advocacy world, it's a smaller network than you may realize. And we're all willing to go above and beyond to help each other.
Absolutely. Yeah. Absolutely. I've seen that firsthand.
I have to do a shameless plug. I do a podcast too, Life Possible with a Disability.
Oh, it's not shameless. It's amazing. No, go for it. I love this podcast.
I'm about to record my 50th, but I mean, that's the whole point of the podcast, is I'm not the expert on any of those, right? Like, my guest is, and I bring somebody in who knows something about that topic. And so yeah, there's lots of resources out there.
Absolutely.
You are an excellent host on a podcast, actually. You ask really great questions. Not everyone is. It's a unique skill set. It's your superpower.
Thank you.
Absolutely. And it is a black hole. One website leads you to another, leads you to another, and it can be overwhelming too. So you do have to streamline yourself and control what you're actually looking for, but make use of these resources, because
but ask for help.
Yeah, Ali and I we have DM messages all the time. Like, you can send us messages. We're gonna reply. I mean, it might not be that day, but I mean, I think we're both pretty darn good.
I am very right. Yeah. I rather be a person who replies to everyone and not be someone that has millions of followers and can't reply to anyone. That's just not my jam. I want to be able to help. And if I don't, I'll point you in the right direction.
Yeah.
So we just talked about that denial process and that cycle that you go through. And I know that everything is very different in what you're appealing and getting denied for. Is there a general timeline of what that might take, or even just how long will some of this take?
Karen, I just had the same look. It takes what you're looking in months. Okay. Because when you have I mean, you're looking a minimum of months, because if you're designed, say you have everything together, you're ready, you're armed for, I have my letter of medical necessity, I have my appeals ready to go for the second, I have my patient, just say you've got the perfect picture of everything. Well, if you have a prior authorization, you have 30 days, and then your first level of appeals, you have up to 60 days, which means they have 60 days to get back to you. After the second, they have another 60 days to get back to you. So measure that, right? I mean, so this is not now. I will say there is a caveat. If it's literally life or death, you can file a 72-hour emergency request, but I mean, it has to be an emergency.
Yeah. And I will say this, if you, depending on who your payer is, but if you are with a private insurance, you can ask for a case manager. So, and sometimes when, like, I was diagnosed with bladder cancer a year and a half ago, and they assigned a case manager to me, United Healthcare did. And when they get to know you really well, they check in on you, and they have access to your medical records in a way that other people that are answering the phone at your insurance company might not. So I would say and when these appeals come up, they can advocate for you internally in a way that someone who doesn't know you might not.
Right. Actually, to that point, what Karen said is they have different names for different pairs. So case manager, customer escalation department, customer care management, they have different names for different departments. Care coordinator, or it could be a nurse, whatever it is. If you have a case that's complicated, it is your right as a patient to ask for someone to take over this case. Because if you keep calling the claims department, you're going to keep getting a different person, and you're going to get the runaround. Now, to get that, sometimes you have to like call the customer care department and then say, I want to speak with a supervisor. And then you demand politely but strongly, I want this manager. And then you build a relationship, because as Karen said, I have somebody like that. When I was going through a couple processes, we're actually great friends now. And when she sees my name, she's like, oh gosh, that's Ali. I better just like pass that through, right? But what helps too is these case managers, they can be like, okay, you're missing this, this, and this is where you need to get it from, because they know better from the internal side, and they see things that you can't. Now, they don't have any control or sway or any decision. They just get it to I think it's called in private insurance and Blue Cross, it's called the care management department. And those are the dudes, those are the guys that girls that make the decisions, right? But they can, your case managers can help you tie everything in a pretty bow and get it to the right department, all in one, not in like piecemeal.
Yeah.
And so with all this, and I mean, all this work that you guys are doing and the advocates, and I want to give a shout out to another one of our partners who's on the chat here, Permobile, who said they also have an advocacy network and
they do,
and all of that. So like Karen mentioned, any vendor that you're working with will most likely have that kind of avenue for you to go through. So certainly make the ask of whomever you are working with. But it is a lot of work. And I know you guys are both fighters, but how do you handle that stress and that exhaustion of constantly having to make the phone calls and constantly having to do the fighting?
We're switching to health and wellness now, Karen.
We are, and that balance, it is important. And you know,
you're gonna laugh at my answer though. Like, it's
probably
no dumb answers. No dumb answers.
I have to go to bed early. I have to like drink water and eat vegetables. Like, it is the most
good answer.
Okay. Because I think that like self-care, like if I have to get myself, and I have to do my workout when I don't feel like it. Occasionally skip I mean, fun is the key to life, but I'm just saying that I have to, it's a delicate balance for me to stay well enough and to stay rested enough to fight that fight again every morning.
That's important, right? And even for individuals that have loved ones in their family that they're taking care of, or any of that self-care, to take care of yourself, is so important to then be able to continue that.
No, I have a similar answer to Karen with a slight caveat on the weird fun side. I do that Monday through Friday. I get up at 5 a.m. in the morning. I do all my morning care as a quadriplegic, whatever my day involves. I have to add 4 hours to that just to take care of myself. Bowel, bladder, dressing, exercise, you name it. Then I'm up at my screens and I'm working all day, or I'm at an event. Now, mid-afternoon, I get in bed around 3:34 because my nerve pain, my neuropathic pain and my spinal pain from my surgeries is so intense. I then I exercise again, or I take a shower, and then I continue to work, but I do it from bed with the head of my bed goes up and I have a computer. I just have to physically change positions. And I'm like Karen, I eat really well. I drink a ton of water. It keeps my energy up. I have little mantras I say to myself all the time. Sometimes it looks like I'm talking to myself. And then on Saturdays, unless I'm traveling or doing something wacky, I have like a 7-hour period every Saturday where I'm like off the grid, and I will find a weird and wacky adventure. I'll go dancing and drinking at the piano bar. I will go to like Comic-Cons. I mean, really funny stuff. As long as I get to meet somebody new and funky. Yeah. And so I post those pictures on social media, and people are like, do you work, Ali? I mean, are you always having fun? I'm like, that is like a 7-hour that is like a 7-hour period of my day. And then Sundays are swim days and
Nice.
in the summer, but in the winter, they're usually just like no phone calls. I just want to
Yeah.
rest and just
Yeah.
be quiet, because sometimes quiet when you're like working it, I'd love to help people. I know like Karen does, but it's when a full-time job and helping humans and advocating
Yeah.
for yourself and trying to survive a life. It's a lot.
It's draining.
It's a lot.
And I mean, Ali and I rely on each other, and you have to have good friends, and
Yes.
you have to commiserate every once in a while. Like, I don't think we dwell in that space for a really long time, but it's hard. And then every once in a while we just stop and go, this crap is hard.
Yeah.
Yeah,
Just
we do. We're
like,
reality. Mhm.
I'm exhausted from fighting everyone all the time. And
Yeah.
it's not just disability related. I mean, life in general can be just quite the struggle. And then you add a disability on top of that. And I'm just like, do I just have to fight everyone all the time just to get
Sometimes.
by? But
And
yeah,
that's why I go sing Baby Got Back at the Dueling Pianos bar. I'm just saying. But even wellness and care, it's like when I'm on webinars, I wiggle a lot, because it's like I get a lot of pain just sitting my shoulders. They dislocate a lot, but just small little things all the time. You have to do wellness. I do a lot of talks on corporate wellness and self-care, and it is so important. I meditate all the time. I live in dark humor. When things go really, like yesterday I was in a hospital and I had a spinal nerve ablation. So essentially they go in with large needles in between several vertebrae and they burn off the nerves, and they want you awake because they want you to feel it. Because they're trying to torture you. No. And I had that yesterday. It's like, I am in excruciating pain right now, but I cope a lot by laughing. So, right, when you laugh physiologically, you release more serotonin and endorphin. So I like mentally get into those zones. So sometimes when I'm in the most amount of pain, I find myself just laughing, and people are like, what is going on with you?
yeah. And I think the key to like some of these things too is like these relationships, like, right, creating
Yes.
relationships with your therapist, with your doctor,
Therapy.
with your case manager, and then like making friends of people who weren't on your side before is sometimes the key to success.
And that's the thing is too, when you say relationships, Karen, it makes me think about when you call your insurance company, and you may call 15 times and you are frustrated and you are angry. And I really get that. But you also have to remember that the other person on the end of the phone, they're an independent person. They may know nothing about your case. So getting really frustrated and yelling at them, that's not going to get you anywhere. It's the sugar and fly and the honey thing, right? So I get that. But also just being like, okay, ma'am, I did an example. I get an osteoporosis shot twice a year. It's about 15 calls, about 8 hours of my life. You think they have it in my chart. They don't. And so by the 8th or 9th call, I'm like, ma'am, I appreciate the hello. Can I please speak with your supervisor? I've been through this. Well, ma'am, what's your story? I could tell you it'll take too long.
Yeah.
If you would be kind enough to just please pass me to your supervisor. Then they're not always happy about it, but you have to remain calm.
Yeah. And we've talked a lot about the denial processes and things in that nature. Have you guys ever had anything that just went through, that just got approved and was easy and was a good experience?
I have.
Yeah.
Oh, tell me.
Yeah, I mean, I have. I think it might be because my chair is less complex than Ali's chair. I'm a manual wheelchair user. I mean, I need an ultra lightweight chair that can be a fight these days. What you didn't used to be a fight. Okay, so it wasn't always that big of a fight. So yeah, there were times when I ordered what I needed and I got it. And I think that's less and less common as time has gone on. But it also depends on the expense of the technology that you're requesting. I think at times. So they're going to fight harder to deny a power chair, I think, than they are a manual chair. So.
Bladder Botox. I get that twice a year for bladder spasms. And it's also good. I mean, if it works for you, it's also good for a number of reasons with prevention of urine backup in your kidneys, for kidney damage, et cetera. But because it's so clinically established and it's got a code, they have never given me a problem with bladder Botox. Mm-hmm.
And just as we're nearing the end of our time here, and again, if anyone has any questions, please put them in the Q&A or in the chat. But as we look forward, and I know in the past couple months, we've seen some changes even in the approvals of that the lift for power wheelchairs and those types of services. And so let's talk about some of the positive changes. What are you seeing in the insurance world? Are there positive changes? Are there changes coming to policy and to coverage that we're seeing down the pike?
I mean, if I will just say with my particular private insurance provider, we are never seeing more denials than we are seeing right now. They just deny everything. They're denying it like right off the bat when it's completely obvious. So I hate to say on that side of things, I don't see any positive change yet. But Ali and I were both very intimately involved with the Item Coalition in getting seat elevation approved. So were people at Permobil, so were people at Pride, New Motion, and a bunch
The
of
list,
other
hundreds of organizations.
like so and all the
Yeah.
nonprofits we mentioned earlier. And it was years, I mean years, like 2018, I can remember being in meetings about seat elevation and standing approval. The painting a picture for legislators is very similar to painting a picture for your insurance provider, for your physician, and for everyone else. They don't know what they don't know. And you have to explain to them why we need this technology, why it's not a luxury item, why reaching and seeing the stove is important, why being level for transfers is important. But the moral of the story is we got seat elevation has now been approved. And so advocacy does work. It's just that it takes a heap of people, clinicians, data, people like Ali and I, and we need more. So anyone listening to this plans to share it, every clinician, every wheelchair user, we need all of you. It can't be just, the core group that Ali and I talk about. We have really big mouths and we have a lot to say, but we need more, right? We need more. It works. Now standing is next. So,
and I won't repeat every Karen said about the Item Coalition every 5 or 6 years. Sometimes, I mean, it's a real honor and we're really excited, but it almost feels like the government is just throwing us a bone every 5 or 6 years. So there's not a full on revolt, at times. But I would say in private insurance. So when I came to the United States in 2015, I was Obama health insurance marketplace. Now there's a lot of issues with Obama. I get that, but I had my pick of the litter with I didn't work for a company. So as an independent contractor, an individual, whether you got a tax credit or you didn't, I had to pay full price, which was fine. You went into the marketplace and they can't discriminate and a whole other host of issues. And I could choose any plan I wanted. I could go to any network I wanted in North Carolina. Fast forward and I was paying maximum out of pocket of $1,500 a year plus my premium, which was about $400 or $500. And it's still a lot of money. Fast forward to 2023, we're down to 2 hospital networks. 60% of my doctors are now out of network. So I had to make very critical decisions over the last several years, which doctors were the most important. I decided my urologist was the most important and my primary care physician. So from a healthcare systemic point of view, I want to say I see change for the better, but it's going downhill at a rapid rate. What do? I don't actually have an answer. Universal healthcare probably won't work in a country made like America because a lot of people aren't willing to give up a huge percentage of their taxes for that. Huge. When you look at Sweden or Finland, these great systems, they also countries have been around for thousands of years that have a real sense of patriotism and pride. In the United States, we're made up of an amalgam of people from all over the place. So you're not going to have that unity. I don't have a great answer, but it's just getting worse, unfortunately. And I have been saying this. People talk about disability employment and inclusion and digital accessibility. That's great. We all have to work on that. And I do every day. But what is the one thing as a person with a significant disability, whether you're blind or deaf or mobility impairment, what do you need in your daily life to survive, to be a contributing member of society? You need health insurance. If you don't have that and you're fighting, it's going to be very hard to deal with every aspect of your life. And I don't want to be a Debbie Downer, but that's just kind of a reality. Like I like to put a spin on things with dark humor, but I just don't have a spin on this one. It makes me.
It's okay. It's
enraged.
The reality of it. I mean, the reality of it too is that's why, unfortunately, Help Hope Live exists, because we have to help people fundraise for their medical expenses because of the system that we're in.
Exactly.
And thank you for doing that, because that's another thing as a social worker, that I had a laundry list of resources for people, because I was like, they'll come to me and they're like, well, aren't disposables covered? Like, aren't, and I'm like, nope. And then, but here's the list of 20 nonprofits that you can put in an application. Permobil has them, and Emotion has a foundation as well. And Sunny, what you guys do is amazing. And I've always thought so.
And what you guys do a really great job too at Help Hope Live is, if you're not needing to raise medical funds, I mean, it is important to have a network, right? So you can send it to friends and family or social media. That is important. If you do have some kind of network, you guys provide great resources on how to create a campaign, on how to do that if you don't know how to do that, which is very helpful. So,
Yeah.
I mean,
No,
I've had a great experience. I worked with Help Hope Live for other advocacy things for a long time. And then long story, I was denied a pool lift for private community, all kinds of legal stuff. And so I raised a little over $10,000 and my pool lift, I'm happy to say, is being delivered tomorrow into my community. I'm
Yay!
very excited to swim
Yes, we're
independently now
excited
without
about that.
someone trying to throw me over their shoulder.
Right. Which is part of that filling your cup back up thing is
The
that
independence and the,
yeah.
the happiness.
Absolutely. So I mean, I want to say thank you to both of you. This has been such a beneficial conversation, such an important conversation that is never going to be finished. It's just going to continue when we hit the pause button here. But I think it's also just the moral of the story from this past hour and with your relationship is truly reach out. This network is so tight knit and really takes care of each other. So reach out, whether it's the vendor, whether it's an individual, social media. I mean, I've seen it firsthand. It is so important to just reach out to whomever you can, whether it's the Reed Foundation, United Spinal, a Facebook support group, the vendor that's selling you your wheelchair. They're all here because they care.
Because if you don't ask, you're going to get 100% no. If you
Yes.
ask, at least it's a 50-50, right?
Absolutely.
There.
Absolutely.
It's better than going gambling.
Absolutely. So as we finish, thank you to everyone who joined us today. This will be available on the Help Hope Live YouTube channel. And we will put it out on our website as well. If you're interested in fundraising with Help Hope Live, you can contact us at helphopelive.org. And we just really encourage you, please keep up the fight. We're here to help. We don't want you to go without what you deserve. So please, thank you so much, everyone. And we'll see you next time. Thank you, ladies, so much.
Thanks so much for having us.
Thank you.